Yo, yo, yo. Hey guys, welcome back to the Best Practices Show podcast, where I have one goal here: to bring you the best information from some of the best educators everywhere and try to make your life a little bit better. And today is no exception. I've got a good friend of mine who is an awesome human being, an unbelievable educator, Dr. Jeff Rouse from Spear Education. And today we're going to be observing or taking apart the whole concept of why interdisciplinary dentistry, it's just too hard for most dentists, and why there are a few that take on that responsibility and go to a whole nother level. And we're going to go right into the eye of the hurricane, and he's going to help us see what he's been seeing for a long time. So Jeff, thanks for being on, brother. Appreciate it.
I appreciate it. I don't know how many times. Do I get some award for most times on
You
there?
get the
Am I close?
Yeah, you're pretty close, because you were one of the originals where I called. And number one, because half the time I don't even know what you're talking about because you're so brilliant. But I just enjoy hanging out with you, whether it be at Seattle Study Club Symposium, a lecture. Now I'm going to forever tell this story. So if you've been listening to the previous podcast, I've got like 30 good Rouse stories. One of my favorite is I'm at the Texas Dental Association. You and I are like, yeah, let's get together, we'll have a couple drinks. And I think this was after you had me over at your house with Winter and we're having tequila and everything. And then you're like, yeah, I'm going to be speaking down there at TDA. And I'm like, all right, well, I just finished a couple lectures. Feeling pretty good about myself at TDA because they got these big rooms and it's all full. And then I walk up to the Jeff Rouse room. And I'm like, throwing my speaker badge around. And they're like, sir, you can't go in there. I'm like, no, I can't. I've got one of these badges. And the lady's like, I don't care who you are. There's nowhere to stand in there. I'm like, whatever. So I go in the room. I'm not joking. Every seat was full. People were lined up on the walls. I had to squeeze between a couple people. And I'm like, he's a dentist talking about Airway. And it was amazing. You were on fire that day. It was awesome. So I'm just here to say that if you've never experienced the magic of this man speaking, you have to. And I enjoy it all the time. And you are truly a professional. And I've told the professional story other times.
Yeah, that's of all the stories, that wasn't the one I thought you were going to go for.
The one was like, okay, so I'll just go there. The professional story was this one, and you guys have heard this one. So we're at the bar at the Seattle Study Club. I got to speak tomorrow. You do too. Robbins is there. I think Marges is there. And I'm all nervous. And I'm like, I got to go to bed. And you're like, oh, you're a wimp. Come on, have one more drink with us. And I'm like, no, I can't. I got to speak. You guys all got to speak tomorrow. I'm like sweating and nervous. And I go, and you look at me, and I think you said something like this. You know what the difference is between you and I? I go, what? You go, I'm a professional. And I was like, yes, you are. And you guys laughed your butts off for hours. And then I watched you the next day, and you were like amazing. And I'm like, I'm never going to be that good. But let's start here, buddy. I want people to know who Dr. Jeff Rouse is. So we got a lot of dental students listening. Who's Dr. Jeff Rouse, if I've never heard your name?
I am a prosthodontist in San Antonio, Texas, but actually I'm going to start the story different than I ever have before. So,
okay.
And it isn't going to even entail any of the other stories that I have about you. Because we're going to talk about practicing at a different level.
Yeah.
And having a different, you mentioned dental students. And I guess one of the nice things about the podcast and their utilization of the podcast is getting a vision of what they may be or could be. So I'll give you a different introduction. I am actually from Bryan, Texas, which at the time was probably maybe 14 to 15,000 people, in that range. It was next to College Station, which is where Texas A&M is. So combination, possibly 40,000 people in that area when the students were around and such. A&M was about 12,000 students when we moved to the town. 50,000 there now. So tiny. I am a East Texas small town boy that didn't have a clue what he wanted to do. Had a roommate. Had a friend in high school that when I decided I didn't want to go to medical school, I always tell the story, I didn't want to go to medical school. there was no friggin' way I was getting into medical school. Let's just go with
Yeah.
that. But when I decided I didn't want to go to medical school and they wouldn't have accepted me, I didn't know what to do. And so I took the DAT on a whim because a buddy of mine was going down there and I happened to score well enough to get in. So when I went to dental school, the first guy that gave me a tour said C equals DDS. And so that's all I knew was C equals EDS. I can make a C. I can do that. That's not a problem for me. Making A's and B's would have been an issue, but C's I can handle.
Mm-hmm.
So I graduated right in the middle of my class. And going into the last year, I had no idea what a dentist did because my mom never took me to one. I had been to one only a couple of times. No idea what they did, how they did it. We didn't have to follow them around or anything. I didn't know what dentistry was all about. And I happened to run into Bill Robbins, who you've interviewed a bunch of times.
Yeah.
And Bill was not teaching my group, but teaching another group and of more gifted dentists than myself. And he happened to let me participate in some of the things that they did, which showed me a different vision of dentistry that led me to go to a residency, led me to work in practice. I started lecturing with a periodontist at that point in time when I got out in practice. 12 years goes by and I decide I want to become a prosthodontist. And while I'm practicing dentistry, I'm doing pros as well. And I finally, in 2004, became a prosthodontist. So I've been practicing since that point in time. In my career, though, I've now practiced with Greg Kinzer and Frank Spear up in Seattle. I practice with Bill Robbins. So I've practiced with some of the best people in the world. But the other cool thing is I come from a town, like I said, small East Texas town, but I have friends all over the world now that I can call anytime and get favors from. I was in Europe a few years ago and I go to dinner with good friends. They bring me into their house. You and I were talking about friends we have in common that we've done all kinds of things with. So for a young dentist to realize that dentistry can be bigger than what they ever imagine is what I hope they hear in that little story, that somebody that was just muddling through dental school and was pretty worthless in dental school can have an opportunity to be in a position like I'm at is pretty amazing.
Yeah.
So I know that I have an advantage in that student loans weren't the way they are now. I get that. And there are pressures that they're going to face that I didn't have to face. But man, there are so many opportunities in dentistry. It is the coolest profession out there. And the stuff we're going to talk about today is evolving dentistry so fast, and it's going to make it so exciting that anyone just coming out is going to have a great ride if they want it. And you just have to make the decision that you're going to, and in the topic we'll discuss, that you're going to go beyond what they taught you in dental school of just dealing with broken things and disease things, and you're going to try to make a difference in people's lives. So
yeah, buddy.
So there's a different introduction. Right?
That is awesome. Actually, I've never heard that before. I love it how you just kind of pivoted on me and like shared a little bit more. But that's pretty awesome. And again, if you're a young listener, I would echo the same sentiment that Jeff said. I mean, this is just an incredible profession. Of all the things I could have done in my life, it's incredibly noble. The relationships are so powerful. It's really a good person industry. That's the way I describe it to my friends. Like, you meet good people everywhere, committed, and I don't think there's ever been a better time to be a dentist. And so I get it. If you feel like you're struggling, keep moving. That's what I would say, and keep connecting, because one connection leads to another, and then at the end,
Yeah, the other thing I'll throw in there is, I read a book called The Celestine Prophecy years ago, which basically is you have to be prepared and listen to the message and be open to the message and be willing to take a chance to move on and prepare yourself. But it also requires you to take some risks. I mean, in the middle of my career, which was going pretty darn well, I decided I wanted to be a prosthodontist, and I figured out a way that I could do that where I would work I would go to pros in the morning and I would work in my practice in the afternoon to keep it going. And I mean, that led me to be able to practice with Kinzer and Spear, to then be able to teach at Spear Education. I mean, I took a chance to go up to Bill Robbins, who was teaching our gifted and talented, and ask him if I could participate in their events. So you've got to be willing to put yourself out there in order to make things happen, and be ready, whether the answer is yes or no, but be ready, because you got to put in a bunch of effort. I mean, it's not like all of a sudden anything came easy. I was working my ass off for 4 years to get it, but man, the payoffs are phenomenal. I mean, it's just, well, just to get to know you. I mean, I would have done it all over again just to know you.
Now you're full of it. You had me until that last comment, but no, I mean, I'm joking with you, but I'm also like, there are times where I'm like, I mean, I've said this before. I flunked out of college, like not once, but like twice, and it wasn't because I just wasn't really paying attention. And then to hang around with you guys, and I think you're exactly right. Like you just got to keep showing up. You got to keep connecting, and people give you the benefit of the doubt when they like you, and if you're curious and you take notes, then you get the extra benefit of the doubt. I love more than anything meeting a young professional who's curious. I'm curious. I really want to learn more, instead of meeting a young professional who's got it all figured out. You know what I mean? And it's a great path. And today we're going to be talking about how the path can even increase, and where you can start to really see a whole nother level of dentistry. Now, I want to preface this. You and I were chatting before we hit the go button, and you've been noticing this trend, and you noticed it most specifically this year at the Restorative Academy, but it's a culmination of a lot of things. So let's talk about the question: why interdisciplinary dentistry is just way too hard for some dentists. Why is it?
The first thing is, you have to feel confident and competent in doing it. So you have to have the education and spend the time learning it. And there are, unfortunately, very few places to learn that. The majority of education we have is focused on technique, because it's it's company driven, a lot of it. Mm-hmm. Right? I learned how to do I want to learn about Emacs. I want to learn about zirconia systems. I want to learn about composites.
Yeah.
Because you're going to do a procedure, and the thought process is, show me how to do that thing, and then I'll go back and do that thing and make more money doing that thing. Or so it's technique, materials, or it's product. Give me a scanner, get me a milling machine, get me a laser, things. But once again, it's materials from a company or product from a company driving dentistry. And unfortunately for us, it also plays into what dental school taught us, which is how to work with materials and how to work with product. So when we go through in dental school and put together a treatment plan, all we do is list what's broken, what's diseased, what I'm going to do about it. Mm-hmm. So it's singular. It's tooth number 2 has A. Tooth number 31 has A. They have this, and I'm going to use this technique in order to take care of it, this product, this machine. And that's not interdisciplinary dentistry at all. So our education is lacking. What education we get is not is focused on structure and biology rather than on aesthetics and function. And even the education you can get in function, in occlusion, doesn't focus on the upper arch, the aesthetic part of it. It's strictly how do the lower teeth work in relationship to what you've got in the upper. So it's not giving you an overall plan. So honestly, you get down to a couple of spots that you can get that education
Yeah.
as to how to get the teeth in the right location in the world to begin the case. So
Yeah.
Coyce was one, Spear is one. Bill and I were teaching global diagnosis, and you're pretty much done at that point in time.
Yeah.
So in the whole world, you got very few options on learning how to do interdisciplinary care.
Yeah. So go back to this. You and I were chatting. You said one of the ways to get patients out of hygiene is that you've got to help them see, interdisciplinary, which is, going that route. And Airway has taken it to a whole nother level, as where it was kind of falling on deaf ears years ago. So give us the conversation now as compared to when you guys were on your quest with GDE and it wasn't maybe so receptive, or that process. Can you explain that?
Yeah, you said things that have changed recently, and it's what I noticed most recently is that I'm all of a sudden there are a lot of younger dentists, younger practitioners that are really starting to practice at a higher level.
Mm-hmm.
And they're starting to do interdisciplinary care. And Bill and I started teaching global diagnosis in 96, or we developed it in 96, 97, and started teaching it right after that.
Yeah.
So we've been teaching it a very long time and have had very little complete buy-in. Lots of people own bits of it,
right.
and it's impacted people. But really, if I was to say, who has it really changed and evolved their practices, that number is really small.
Mm-hmm.
Throw Airway into the mix, and all of a sudden, my people that are around me now with the Airway part and how we're linking it into interdisciplinary care, now that number is bigger and bigger and bigger. It's probably, in the 4.5 years I've been at Spear, bigger than the entire time that Bill and I taught together.
Yeah.
And I think the reason is Airway gives you the opportunity to get the patient out of the hygiene operatory, whereas talking to them about their teeth are worn, their teeth are in the wrong location, the teeth have the gums covering them, they need to be pushed back. Harder conversation to have with people, much more difficult, especially wear patients. Malocclusions, really difficult conversation, because you don't want people, when they're brand new to your practice, to think you're just after their money. Right. I've been seeing, I saw Dr. So-and-so for years and years and years. And well, thanks for coming over and seeing us. I know he retired recently. It's really great that you're in with us. And then you see tons of wear and you're like, I can't say you got a bunch of wear that's been ignored for years, because you're going to think I'm after your money. And so you go, well, there's a lot of wear on your teeth. I'm sure he'd been monitoring it for years. We're going to continue to keep an eye on it. Well, you just monitor yourself right out of a bunch of dentistry that needs to be done. And it's true of a lot of different things, in that we just kind of don't want to rock the boat. We'll wait till something breaks before we actually, tell them that they need something more, right? So structure and biology have to break down before we're willing to look deeper into what's going on in the majority of our patients. When Airway came around, the discussion changed, and you can get people out of the hygiene operatory now. And the way you do it is the same patient with wear in their teeth and malocclusion and all the rest. Today, all you do is say, and it's interesting because I'm noticing you have some wear in your teeth and your teeth are somewhat crowded. When you smile big, I don't see the smile, that kind of Hollywood big, broad smile. I don't see that with you. The thing what I mentioned though is it's interesting because the current literature is telling me that people with smiles like yours and people with wear in their teeth like yours typically have a very difficult time breathing while they're asleep. How long has your wife complained about your snoring? Or the other question I ask people that I don't think are full-blown apneics is I'll ask them, how do you sleep at night? Do you wake up at 3:10 in the morning? One of those two questions will usually elicit a response.
Yep.
And if it does, now we have the hook we need to get them to come back for a more comprehensive evaluation.
Yeah.
So I've told them what I'm seeing can be an airway issue, can be an unhealthy condition. It could also look like I've got a patient coming tomorrow that I was looking at their medical, and they've got all these disease processes that are happening at a very young age. And I could look at that and go, it's interesting. The newer science is telling us people that have these things wrong with them medically typically have difficulty sleeping and breathing at night.
Mm-hmm.
How long has your wife complained about your snoring?
Yeah.
Now you've linked into it. Well, all I want the airway part to be is a way to get them to come back to do a more thorough dental evaluation. Now, when I tell them you need orthodontics, you need your teeth moved, you need your teeth fixed, I'm doing it under the guise of making them healthier. I can't promise them they're going to be all better, but I can promise, completely better and cured, but I can promise them if you do these things, it will be a positive change. A little or a lot, don't know, but we're going to get a better smile with better function, and you're going to be a little or a lot healthier in the end of this process.
Yeah.
So now I've got young dentists that are insecure about talking about wear on teeth, and the patients are coming to the hygienist and they're, rushing around. They can go in there and very quickly get the patient out of the hygiene operatory and into their operatory, where they have an opportunity to do a more comprehensive evaluation and then take the time to present a more comprehensive treatment plan.
Yeah.
But whereas before, that patient would be gone.
Mm-hmm.
They would have never had a discussion with the patient. And I think that's why I'm now seeing this increase in younger dentists doing what I'm going to call better dentistry, at least more exciting dentistry, more profitable dentistry than they ever have before. It's not because of the way we now teach it at Spear versus how Bill and I taught it. It's because Airway looks at skeletal and dental alveolar as it relates to the skeleton differently than we ever have. It adds this extra piece. So that's why I think it's changed.
Yeah, and don't you think we're getting a lot of help now too? I mean, you can't turn on a TV without hearing about better night's sleep. You can now buy mattresses, you can buy pillows, you can buy all these things. And if you open up a glass of wine on a Friday night with a whole bunch of couples in your kitchen, 75% of them have sleep challenges, whether it be male or female. I mean, one time, I don't mind sharing this. When I just met you, I had some challenges. And then I remember being so self-conscious as I was going on this path to breathe better, doing the CPAP, which I know is a Band-Aid to start. And then I was so nervous to tell any of my neighbors. And I found out like 75% of my cul-de-sac, I'm like, we have been friends forever. And you have been on a CPAP for how many years? It's like, and now it's like common. So I think dentistry is getting a little bit of help, don't you? At least with some, we all know that sleep is an important piece of this, which is an exciting thing. And then go back to this.
It's even,
oh no, you go.
It's even better in that because there are so many people being treated with regimens like CPAP and stuff that don't want to be on it.
Right.
It also offers you an opportunity to have discussions you've never been able to have before. I get a fair number of people that'll say, oh yeah, I do have, I don't snore anymore, but that's because I got my CPAP. Well, how you doing with it? Oh God, I hate that thing. Well, are you interested in pursuing some options where you might be able to at least turn down the pressure?
Right.
Airway gets people in for comprehensive evaluations, and it gets them to do more complex, comprehensive dentistry than I've ever had opportunities to do before.
Yeah. Well, and you're not going to do this, but I'm going to do it. I'll give you a lot of credit because you were really good and still are amazing at dispelling the rumor that, sleep apnea or breathing issues is for the heavy male patient. I mean, that was a box that we put everything in. It's just not true anymore. And now the conversation is so big. We're now, talking about kids and everything and paddle and skeletal. So it's just an exciting conversation. Go back to this. So of this group, these young stallions you've been running with, and I'm having fun with you, but like you're seeing them, and it's not so much that they're getting heavy into Airway, it's that they're thinking better when they look at the treatment planning process, right? I mean, go on that journey if you're a young dentist listening to this. How does that work, and what are you noticing?
Yeah, well, and I guess the first thing you're talking about young stallions and stuff like that. It's for me as an educator, it's the coolest. And I'm sure you've gone through the same deal where when you first started talking, it was all about you. Like, I'm hot. I'm hot, because I'm up in front of this whole
Right.
deal, and I've got this room full of people, and this is about me, 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 me.
Yeah.
And that passes pretty quickly when you're on all these airplanes, and then it becomes a job,
Yep.
and one and and it becomes a job that wears you down pretty
For
fast.
sure.
So I mean, it's tough, but then to now be on the other side of all that and have all these new people coming out and seeing the world the way that I see it and doing really well, I love that part. So I just, I had a, I had one of them send me a podcast that she was on this morning. So while I was sat at my desk, I would listen to her talking, and to hear her talking and hear my voice in there somewhere.
Oh yeah.
And yet beyond my voice, it was her voice that created a new, a new story. It was so cool. So anyway, as a young dentist, I guess the end of that long little moment was, there are people out there that want to help you
Yeah.
be better than what you are right now, and to achieve better than they are. If you're excited enough to be one of the best, there are lots of people that are willing to help you get there.
Yeah. And
But
I know
you got to
this.
put out.
Yeah, I know this about you, and I would tell you like that. What you just said is absolutely true. Like if you ever do any speaking or teaching, it's all about like you're all in your head about like I got to impress these people, and then you realize, oh, it's not about me. I got a great sermon. Like a great sermon is never about the person. You're like, that guy was talking to me, like he was telling my story, and I had a coach one time say, a lecture is never about you. It's the person. It has to they've got to feel it, and that's now the other transition that happens that I know that you're pretty happy about is there's nothing better. That nothing gives you greater joy when this kid that you mentored, she goes farther than you do. Do you know what I mean? Like that brings you so much joy. Like you actually feel so much significance watching a young female dentist go way farther than you, and you just smile, right?
And I've got a bunch of them that are doing that right now. So yeah, it's very, very cool. So your question, if I was a young dentist, how to go about doing
Hey, I just
that
enjoyed
process?
talking to you so much. I forgot my own questions. So let's go back. I want to talk about.
I kind
I
of went off
know
on a tangent
we did,
there.
and
I know.
that's kind of how.
I want. When you started by saying young dentists, it just um for so many years I was so competitive with everyone, and it's what got me where I am. I mean, I got to be. I am a good prosthodontist. I can do good dentistry.
Yeah.
And I think as well as I think most, I can think as well as most anybody. Think through things. So I'm pretty darn good at what I do. And it was because I wasn't going to let anyone be better than me. And then I worked with Greg Kinzer, and I was like, oh crap, he's better than me. But it made me better. I could never catch up to him because he's phenomenal with his hands, but it made me a better dentist, and I was still competitive. And then when I would teach people, I would be competitive. Like I didn't want them somehow getting, I want you to learn, but I don't want you to learn that well. And now I'm like,
Take it
man,
all.
I want you to, whatever I got is yours, and make it better. I'll listen to you, and I'll steal from you down the road.
Yeah.
Young dentists need to know that they they there are people that want to help them, and a study club format is probably the best way to go about doing that. And the two that I've been associated with are Seattle Study Club and Spear Study Clubs.
Yep.
And they both have their own advantages and disadvantages. But they're both critical. In fact, if you can be in both, it's even better. If you could figure out a way to get in both of them, that would be awesome, because you get the advantages. You just take the advantages of both of them. But if I'm young, I'm getting in a study club in my town, and I'm sucking it up and paying whatever the money is to do that. And then I'm educating myself less in technique and product and more in how to treatment plan better.
Yeah.
Because once I learned that, then the technique stuff follows. Because I got to have somebody to work on.
Right.
And I don't want to be working one tooth at a time. I want to be working on 10 or 14 or a whole mouth, 28 teeth. I want to work on a bunch of teeth at a time. And then I want them to pay me fee for service rate rather than insurance rates. And so there's an evolution that comes, and you have to follow the sequence, which is learn how to treatment plan first. Put all your effort into learning how to treatment plan, and that includes components of occlusion as well as smile design and as well as airway things. Once you got that nailed, now you can start feeding these other things into it.
Yeah, totally agree. Now let's go back to the original, and I'll ask your question in a different
Well,
way.
I'm going to ask you a question first,
Oh yeah, okay.
because you work with dentists all over, right? The
Right.
practices you work with that really know how to treatment plan are easier for you to work with and grow than people that are. Am I right? I don't know. I'm just
100%.
throwing that out.
Yeah. I mean, you nailed it. Like, I think in order for you to do fee-for-service dentistry, the stuff that you've been called to do, you can't just get off of insurances. You got to do exactly what Dr. Rouse said. I mean, you got to be really good at something. People have to come to you for a reason. Like Jim McKee is one of my favorite. Like what he does, I think is the hardest thing in the world. I actually don't even think he's a dentist. I tried to Google him one time. I couldn't find a website. Like he gets all these patients coming in and he loves it. He loves that puzzle at that level, but he has chosen a specific discipline that people need and a lot of other dentists don't want to treat. And he's the man. Do you know what I mean? And people will gladly reach into their pockets and pay. And, the whole treatment planning process, I mean, the fulcrum for Seattle Study Club and, a lot of, it's just that well, number one, it's the people, but number two, it's like, how do we think better and treatment plan better? Because I'm going to screw this quote up, and I always do. There's multiple treatment plans, but there's only one diagnosis. And in the world, it's all about following that process. And I think you can choose your path. Now, I want to ask you this question. When it comes back to interdisciplinary dentistry and why it's too hard for some dentists, do you see the path getting better than it was years ago? Do you see more people going the interdisciplinary route because they know more of Airway? The percentage is getting larger ultimately, or are the percentages still going to be the same for the most part?
That's a good question. The problem is people call Airway stuff that it's not.
Yeah.
They continue to call sleep appliances Airway. Like I focus on airway in my practice. Well, what do you do? Well, I make sleep appliances. That's not airway. That's holding the jaw forward at night so people breathe better. That's not airway. Airway is about focusing on the poorly developed skeleton, developing or developed skeleton that has altered the patient's ability to breathe nasally, and changing that environment back to a more healthy environment, hopefully at 3 or 4 years old. But no matter at what age it happens to show up in your office. So airway is, if you think about it from in a dental term, airway is never accepting the wax rim that you've been given for a denture, always evaluating it and modifying it before you ever set teeth. So if the wax rim is too small, we have, as dentists, been just accepting it and trying to get the teeth to fit the best we can. And what the wax rim is telling you is it's unhealthy. So if, a lot of words here, but if you look at if you were to put a wax rim in and the wax rim is deficient in any dimension, that person is unhealthy. And could be better if you moved the dimensions into a more normal position. Now, if you follow that logic out, you would also have a prettier smile and better function.
Yeah.
So, is it going to get better? It's getting better for the people I'm around.
There you go. Yeah.
I guess that's my only answer, because no one else is teaching this.
Yeah.
Kinzer and I, Greg Kinzer is a prosthodontist that also is is the lead teacher at Spear. And he he practiced with Frank Spear for years, and Bob Winter, and me.
I like that.
And we, on our treatment planning course, on the last day, we will treatment plan cases that people bring us. And what we notice is that the maxilla is off on all the cases. It's routinely off. It's routinely retrognathic, or in a transverse too narrow, something to that effect. And the science is caught up to our conjecture, and the science is now supporting our thought, which is that those people are unhealthy. So we've got the science to prove that now. And we were teaching, I don't know, maybe January, I think it was the course then. And we happened to, in the middle of going over one of these cases, look at each other and say, there's nowhere in the world teaching this right now. There's nowhere. If you want to go there, there isn't. There's nowhere in the world teaching that you ought to alter the maxilla to get a person healthier and get the teeth in the right location. That doesn't exist. And yet science is saying that's what you ought to do. Especially in the world of the ENT.
Yeah.
ENT literature is coming out and is replete now with information suggesting that maxillas need to be altered, need to be changed. And we've known for years it needs to be done in kids early on. So your question is it changing? It changes in my world because I'm seeing a bunch of great dentists that are really amazing now, doing amazing stuff because they've incorporated it. But I'm also seeing a bunch of people that are going to places and learning information and doing better dentistry, but not evolving to that particular level. So yeah. I think that's the difference.
Absolutely.
So,
awesome, buddy. Well,
so
I know we're only starting the conversation here. I have so many other topics I want to cover. And yes, you will win the award for most frequented guest. Any last thoughts, Jeff Rouse, on this whole topic before we wrap it up? Because I know I
no,
can't keep
I
going.
hope it came across that for the younger dentists that that are listening is that, and I'll say it again, that there are people that want to mentor you.
Yeah.
Study club is a great way to go about doing it. Focus your education on the big picture and not the small payoff. Decide you're going to set aside some money to pay for better continuing education rather than just although you and I enjoy the Texas Dental Association meeting, you're not going to grow as a dentist going there. You're going to just get some sense of where to go next. And I think podcasts can do that just as well nowadays.
Yeah.
There's many opportunities as there are there. But I guess my biggest hope is that we can get more and more young dentists that want to grow and become really excellent clinicians of the entire mouth and don't just focus on the structure and biology issues to really help patients refine their smile and their function and become healthier, because it's so much more valuable for the patient, and it is so much more exciting for the dentist. I mean, I've been out since 1988, and I get more excited now than I was before because of this evolution. I love trying to figure out these puzzles.
Yeah.
And I would urge everyone to really dive into it, because dentistry is a blast when you do that, and it's just a drain if all you're doing is working on, ones and twos all the time. Do something bigger, see a bigger picture.
Amen, brother. Love it. Love it. Love it. Now, I also want people to be able to see what you're up to. So, Jeff, if I'm listening and I want to get more involved in what you're doing, either at Spear, like, where can I go? Like, what do I do?
SpearEducation.com. SpearEducation.com. We're teaching. Airway has 2 workshops this year. We're going to actually split it off next year. We're creating 2 different workshops because the concept of Airway is too big to just have one. One of the Airway workshops will be about the airway itself and the impact it has on health and the impact it has neurocognitively, attention deficit, those types of issues. And what we can do about it, what types of care, including sleep appliances.
Yeah.
And the other one is going to be advanced treatment planning, which is the stuff we just talked about. How do I take a treatment plan that I used to do this way and evolve it to become more of a health-based treatment plan and get better smiles and function? So one will be about the biology of the system and some of the solutions that are more mechanically based, and the other is going to be take all that information and go, okay, now become this bigger dentist and really play a great, move forward in your community.
Yeah, I love it. So we're going to put the show notes in there. So if you're listening on Spotify, Stitcher, iTunes, you can flip up to the show notes. You'll be able to see links to all that. So thank you, brother, for being on. Appreciate you as always.
Sure, that was awesome.
And I got to find
Thanks.
out the next time you're going to be hosting one of your cool parties at your house, because I'm coming. And I don't even care if I'm invited. I'm just going to show up. So
I'll send the limo.
Oh, dude, those are the best. You're the best. So stick around when we say goodbye to everybody else. But thank you guys for listening to the Best Practices Show podcast. If you enjoyed today, which I know you did, do us a favor. Hit the share button and share this with your friends, because we always love, meeting new people, and our community grows as you only share it, and keep sending us suggestions for things that you guys want to see, and I'll get Jeff back again and again and again. So until we see you guys next time, keep watching the Best practices show. You guys enjoy the rest of your day.